Hey guys, Nick Drossos,
And Dr. Laurent here.
and welcome to Man Yourself Up.
And today we are going to talk about acne and rosacea. How to treat them, how to recognize them.
So, what's the difference between acne and rosacea?
Those are two different things. Acne comes more early in life, let's say in adolescence. We all went through it. And rosacea might come later in life, in your 20s, 30s, and stay for way longer than that. And we both treat them by creams. Not treat them, we don't cure them. We suppress them. That's what we do. We suppress them. So people need to understand that these problems can cause a lot of psychological issues. Let's start by acne. Acne is an inflammatory condition. That is basically due to hyper secretion of sebum and also lack of your skin renewing itself. So,
is it a genetic factor? Because I had acne. I was on Accutane.
yes.
Around 19 years old, I got. It's really weird because I had a huge breakout.
Okay.
Thank God, nothing on my face, but my back, I was getting like craters of. And then I went on Accutane, which
Helped you?
helped me, mind you. It was like, I have never been more. I remember being on Accutane and the feeling of being depressed.
Oh, wow.
Not wanting to go out. It really hit me hard. And I couldn't understand why I got it out of the blues. And the Accutane did help. And it went away, but then I got nothing else again. So is it a genetic factor? Is it a environmental factor?
Acne can be caused by several things, Let's say by hormonal factors, We can see in men can have more acne. We can have women that will have acne for longer if they have polycystic ovary syndromes, what we call PCOS. And we can have acne from lack of hygiene too.
That's true.
It's back to basics. We need to make sure that we have a good routine. Let's say that we wash our face morning and night. That we put a cream, that we hydrate our skin, and also if there is acne, we need to suppress it. We need to use cream. That's the first line. We use things that are called some retinoids. That's what we use. We can use Accutane, but that is far away. We can use some antibiotics to help you because there is a bacteria, Cuteinobacterium, if I'm not mistaken. That bacteria can cause you to have more cystic acne. So, and also we can use oral medication too, like antibiotics, Accutane. And at a point in time, acne will go away, but if you pick on them, you will have scars.
When you
Yes.
I have a thing, I love popping them. I'm like,
You should not do that. Do not touch them. Let them go away.
So you're not supposed to touch them at all?
No,
even
you
if
don't touch them.
You're not supposed to pop them and let them come out and like put some...
It will come away, but it will come out by itself. It will pop out.
And what about what about the foods that you eat? There's this idea that what you eat will...
Well, I haven't read any studies about that, It was not studied well, the food and acne. What was studied is genetic factors were studied, hormonal factors were studied, and environment can do that too, and hygiene.
Can stress create acne?
Of course.
Yeah,
of course, because when you have stress, you will have more cortisol, and cortisol can make you secrete more hormones that acts on acne.
Wow.
Yeah.
So the idea is that so acne happens when you're younger.
Yes.
But then, how do you explain people who are older and get acne?
Well, let's say it depends.
Like what's young? Like
What's young for
puberty
me?
Is
puberty is what I call
normal.
young, up to 20, 25.
Yeah.
Some people can have acne up to that, but let's say that you have acne up to your 30s, 35. There is something that we need to go look for. Let's say for some hormonal imbalances that we need to look for. If it's a man, are you taking? If the person is a man, is the person is taking any hormones, any steroids? They cause acne too.
Yeah. Is that the reason why when you see like, because I know guys on steroids and you see them like
beefy,
their jaw, their body transforms, but then you see like big pimples in their back and their face.
Yes, it's caused by testosterone. Yes.
So too much testosterone will create.
Yes, it's the same hormone that creates that problem in women too. It's the same hormone, DHT. Dihydrotestosterone, yes.
So what about people who are on TRT? Does that mean they're going to get automatically more?
Not necessarily. Some people have TRT and they don't develop acne, but most of them will.
Okay.
Most people will have acne on TRT. And also acne can be caused by, let's say, by a treatment. Some treatment that you might cause might make your skin more sensitive and you will have acne easily.
And the other one is, like we talked about, rosacea?
Rosacea.
What is that?
Rosacea is completely something. It's something that people don't understand, and most men live with it for long, and they don't know what is it. It's an inflammation. It's an inflammatory condition, okay, of your skin, that will cause you to be red. Okay, it's central facial usually.
What does central facial mean? Like,
let's say here, all around your cheeks, and up here. Stays here. So it will cause you to be red, and you might have some pimples. We have different stage of rosacea, which is not what we are going through today. So and it can go up to some complications, scars, sensitive skin, dry skin, okay, and pimples, psychological issues. People. They can, some people might have that problem and don't think about anything. Okay, it's okay, I will just go see my doctor and treat it. Some other will come for a psychological issue, and when you try to dig deep, you see it's the problem is facial. So you need to counsel them. You need to have a good history on them, examine them, treat them, suppress it to help them live properly. So that makes a difference in people's lives.
So when you see like people with scars, like what's the best way to treat it? I know we're going to talk about PRP, but is it PRP in the face or is it?
PRP can help that too. So we can start by doing some retinoids on the skin. Okay, some people might use peptides, some other people might use Accutane. Okay, we can do PRP, we can do laser, all of those can help with scars, okay? So they change the structure of your collagen, so it changes your skin, so it helps, okay?
Is there a way what's the best way to avoid? Is there a way to avoid getting acne or like getting these skin
so
conditions?
when you get acne, you just go to your professional or your esthetician, let's say, and you make sure that you are treated properly. Just treat it early. So I won't let an adolescent with acne, okay, drag it until they're onto their 20s,
Okay.
I would prefer to treat it early, suppress it early, so we need to treat it in the early days,
There's do facials and all these, like doing facials and,
you don't
and all this stuff.
necessarily go do facials, okay? So if you treat it early, some people think that it's mandatory. It's not. If you treat your face properly, if you don't rub it excessively, you might treat your skin condition easily. That's easier, man. There is not a lot to do. You just see your professional, you get things done properly.
And if you get acne when you're young, like if you don't get it when you're young, does that mean you'll never get it later on?
Well, some people, everybody usually have acne, okay? You won't develop acne later in life. If you do, there is something not going okay. So we need to look for it. Okay, we need to look for it. So how do we manage that? Always skincare.
Yeah.
Start by skincare, skin routine, making sure that I've already said it, and I don't know how many times I have to say it. So we need to hydrate our skin, making sure that our skin is healthy. Okay, making sure that we have sun protection, making sure that we see our professional if there is something that we want to deal with.
So all that is going to prevent acne.
Well, preventing is yes.
You're just putting the odds more to your favor
Exactly.
to having a better skin.
Yes, that's always it. That's always it. Back to basics, guys. Just wash your face, hydrate your face. Sun protection will help you to have a greater skin and to age gracefully. So that's what we do here. We try to help you with your aging.
I think I'm going to need a facial soon.
I haven't said anything. I haven't said anything.
So guys, I hope you enjoyed this episode of Man Yourself Up.
Yes.
Dr. Laurent, thank you so much.
My
and
pleasure.
guys, just keep it simple like we were talking about.
Exactly. It's always about hygiene, skincare, always. You can take care of your skins, guys. You can do that.
I hope you guys enjoyed this episode. Make sure to subscribe, hit the bell, and we'll see you guys next week.